Cynthia, yes, indeed. The city is asking businesses to start preparing for that reopening, many of which have been lobbying for some time to do so. And quite frankly, many of us have been waiting for these businesses to open as well. Toronto Public Health will be offering guidance for restaurants as well as personal care services like hair salons and barbers to safely reopen once provincial orders are lifted. More than 10,000 businesses in the city would fall into these categories and have been closed since emergency orders were given nearly 3 months ago. Both the mayor and the medical officer of health emphasizing those businesses can't reopen just yet.
We want people to be able to get ready. That's why we're providing public health's advice now ahead of the lifting of provincial restrictions. To reduce the risk of COVID-19 to staff and customers alike, these guidelines address things like physical distancing, enhanced cleaning and disinfection, and other public health requirements that must be followed when these businesses reopen.
A few highlights of what these businesses are being asked to do and what their customers can expect include physical distancing measures in place and practiced as much as possible between customers and staff. This includes the need to put space between tables to allow for that physical distancing. Barriers such as plexiglass are recommended. Frequent cleaning and disinfection of surfaces and frequent hand washing will also be required.
In other news, as part of the city's new active TO plan to expand the cycling network, a new separated bike track has been installed along Dundas Street East from Sackville Street to Broadview. It's a temporary 1 kilometre stretch, the first of 40 kilometres of new cycling infrastructure approved by City Council last week. Now here's your latest Toronto COVID-19 numbers. With an increase of 198 cases, Toronto has now topped 12,000 today. 9,304 people have now recovered. 352 are still in hospital, with 86 of those in intensive care. 890 people have now died. Now, with more protests expected this weekend, Dr. Eileen de Villa is putting forth some recommendations on how people can stay safe in the COVID-19 perspective. She's suggesting that people do different things, and some of which you might not expect.
Things that can be done in the context of protests to try to minimize risk, using things like drums or signs rather than shouting so as to minimize the spread of droplets from your mouth as you speak or shout, will also reduce the risk of COVID-19. And if for some reason you are not able to maintain physical distancing, as is advised everywhere, we would encourage people to use a face mask or covering.